to today's Meet the Experts Live webinar series, Transforming the Healthcare Supply Chain. We will get started with the webinar in a few minutes, but for now, I'd like to show you some of the tools you can use to get the most out of this presentation. In the upper left-hand corner of your screen, you can read the biographies of our speakers today. Below that, you can find the Resource Center with important websites, including a link to register for our breakfast session at HIMSS 2015. If you have any questions during the webinar, please type them in the Q&A box directly under the Resource Center to your left and hit Submit. Our speakers will be answering questions at the end of the presentation. Share and be social during the presentation using the Twitter, LinkedIn, and Facebook icons at the bottom of your screen, or click the Share This icon next to those for other social sites. To contact us regarding today's presentation, please click the email icon at the bottom of your screen. A representative will be happy to get back to you with answers to your questions. Click the question mark icon at the bottom of the screen if you experience any technical problems during today's webinar. If you notice that the slides are not moving, try refreshing the screen by either hitting F5 on your keyboard or closing out and relaunching the presentation. And finally, thanks for your feedback about today's webinar. It's important to us. We would greatly appreciate it if you would take a quick survey at the end of today's event. To fill out this survey, please click the List button at the bottom of your screen to the right. Survey respondents will receive a copy of our Healthcare Supply Chain White Paper in appreciation for your time. Thank you, and thank you for attending today's Transforming the Healthcare Supply Chain webinar. I'd like to introduce our host, Marcio Nobrega, Services Practice Leader for US Dynamics at Microsoft. Marcio, you have the floor.
Hello, everyone. Thank you for joining the webinar From Volume to Value, How the Affordable Care Act is Driving Transformation of Supply Chain in Healthcare. My name is Marcio Nobrega, and I work with Microsoft Services, a global organization with more than 20,000 professionals and experts in Microsoft technology. One of our goals is to increase our expertise on selected industries, and we do this in two ways. Number one, we continue to hire and develop experts who know how to apply our technology to a given industry. And number two, we partner with great companies that are recognized as best in class in their industry. And the topic today is healthcare, and I'm happy to introduce Mazik Global, who is working with Microsoft Services on a joint solution for supply chain management. With that, I'll introduce you our host today, Dr. Jennifer Hessenjäger-Smith. Jennifer is Mazik Global's Chief Medical Innovation Officer. Jennifer, you have the floor.
Thank you, Marcio. As Marcio said, my name is Dr. Jennifer Hessenjäger-Smith from Mazik Global, and I'd like to welcome you to the Microsoft Dynamics Cafe webcast. I'll be hosting today and discussing our topic, From Volume to Value, How the Affordable Care Act is Driving the Transformation of Supply Chain in Healthcare Today. I practiced eye surgery for many years and have seen firsthand the issues we'll be discussing today with our featured guest, Patricia Becker. Pat is Chief Strategy Officer at Mazik Global. She has 25 years of executive healthcare information technology experience. This includes her tenure as the CIO of the University of Chicago Medical Center and University Health System Consortium. She also teaches in medical informatics in the Medical Informatics program at Northwestern University. Pat, thank you for being here. We're all looking forward to discussing these important issues with you today.
Jennifer, thanks so much for inviting me. I'm glad to be here.
Great. Let's get started. When we talk about how the Affordable Care Act is driving the transformation of supply chain in healthcare today, the first area we have to tackle is cost, but also distinguishing between different aspects of cost.
Yeah, Jennifer, you're correct. In most industries, there's a clear connection among the cost of goods to produce a service, the price that is charged for that service, and the revenue that will be received from that service. How does healthcare differ from other industries with regard to cost, price, and revenue? In healthcare, the relationship among these three is very muddied, and often there is no relationship from one to another. If I'm going to make a phone, I know the cost of the labor to produce the phone. I know how much the parts cost. I know what it takes to transport the phone from where it is produced to where the customer will buy it. I add a certain overhead to these costs, and then I price the phone based on these costs and what the marketplace will bear. I can determine my revenue for that phone by subtracting the cost from the price I sold the product for. Well, this is a simplistic example. It is how most businesses work.
Pat, what factors muddy the waters when it comes to healthcare?
In healthcare, we often do not know what the cost to produce the service is because we do not capture all the cost. If you're doing a hip replacement, the cost of the procedure is likely dependent on the preferences of the surgeon for using one device instead of another. We likely do not know all the cost of the sutures, the scalpels, the drapes, the IV bag, the anesthesia used on that procedure. Then there is the pricing of the service. One-way pricing is based on what Medicare will pay for the service and then triple it. A second example is to find out what the hospital down the street charges for that service and then add or subtract 10%. You will notice that neither of these methods look at what it takes to produce the service, how much labor or product.
Those are great points, Pat. As a physician, I'm aware that there are many drivers challenging the status quo in healthcare today. One major driver is the Affordable Care Act, which is changing the relationships among providers, between providers and patients, and between providers and payers. In what ways do you see these changes impacting healthcare organizations?
You know, we're in a sea change in terms of healthcare these days. Care is being judged on the quality of services provided and the outcomes. Reimbursement is moving away from pay for services to pay for outcomes. Services are being bundled so that the physician, the hospital, and support services receive one bundle payment for all the services they provide. All this means is that we need to understand the outcomes of the service you provide, and you need to completely understand the cost of those services and the procedures that produce them. So that while you are providing high-quality services to your patient, you're doing that in the most efficient and cost-effective manner possible.
So, Pat, you're saying that it's become crucial for healthcare organizations to have highly accurate financial and outcomes information. That's quite a tall order.
Yes, it is, Jennifer. But in order to have the knowledge of your performance, you need systems based on the most up-to-date technology that are intuitive for your staff to use and provide you with the information to make complex decisions to know how to divide your revenue based on the cost of your services.
So the new focus on outcomes results in a shift from volume-based payments to value-based payments. How does the new value-based era change things for healthcare organizations?
When payment is based on value, we need ways to predict what that value will be. While there has been some financial risk today is different. Moving into the future, the risk will be based on the outcomes for the services provided. The cost, quality, outcomes apply to the supply chain as well as other departments in the hospital. In order to participate and lead in this environment, the supply chain leader will need to be have much better information about what they are purchasing, information about cost efficiency, the quality of care, and the measurements of outcomes.
Thanks, Pat. It sounds like the supply chain is suddenly elevated to being a strategic pillar within the hospital's operations.
I agree. So what are some of the activities that supply chain management can do in order to help the organization achieve the operational efficiencies needed to support the new era? We have identified 4 key processes that will go a long way in assisting the organization in being successful. They are automate supply logistics, manage and contain supply chain costs, convert to just-in-time inventory management, and increase transparency.
Well said, Pat. Knowing how complex healthcare systems are, I imagine there are many challenges along the way to successfully implementing those 4 processes you just mentioned. What are some of the potential blocks you see for supply chain administrators?
In the current environment of a typical hospital, it is difficult to know the true cost of providing health care. While there are many factors that contribute to cost, the price of drugs and supplies are second only to personnel. It is difficult to capture the full list of items utilized in a given procedure. Systems are not in place to consistently account for each pair of gloves, syringe, or the use of multi-use pieces of equipment such as surgical instruments. Most current hospital charging systems set an average cost to a given procedure, but don't take into account individual variations from case to case.
So, Pat, you're saying that actual costs for an individual patient procedure are not accurately tracked in real time?
That is correct, Jennifer. This lack of data makes it impossible for managers to truly itemize costs for a patient's stay. It leads to chronic leakage of supplies that never get accounted for, let alone related to a given patient. With integrated supply and medication costs, a patient account is accurately and automatically related to the supplies consumed during his care at the time they are used. Documentation of the costs occur automatically, and human error is taken out of the equation. The difficulty around procedure costing is removed, allowing for better resource management and knowing the true cost of providing care.
I agree, Pat. As a surgeon, I routinely saw stashes of crucial supplies hidden in the OR, just in case we needed them and they somehow weren't available from central supply. Those hidden supplies were not accounted for in the supply system if they were used, and would often expire before they could be used. It always seemed a wasteful but necessary way to ensure that we had what we needed when we needed it.
Isn't that so true, Jennifer? But when staff gain trust that supplies will be there when needed, this behavior will stop saving costs because supplies and medication will be used before expiring and inventory levels are lower.
Pat, how do you gain staff trust that needed supplies will be there where and when needed?
Real-time information to the supply manager about the location of every supply item will be able to prevent most supply-related procedural delays and rapidly address issues when they occur. By making the information about supply location easily available, missing supplies will be found, cost inefficiencies will be removed, and outcomes will even be better. And customer service ratings will also improve. Use of supply exchanges, barcoding, RFID, handheld devices facilitate automating logistics, making the information more readily available when it is needed.
This is very important stuff. Because a patient's health and even their life can be at stake, running out of a mission-critical supply is an unacceptable possibility in healthcare. For that reason, huge overstocks of many items are kept, which is just the opposite of just-in-time inventory. What is needed in order for healthcare organizations to move to just-in-time inventory management?
Even as most other industries have embraced the power of just-in-time inventory systems, healthcare organizations have not been able to take advantage of this far more efficient approach because it requires accurate, real-time data. With approximately 85% of healthcare procedures planned in advance, there is no real need for the levels of overstocking that are going on. Working with your supplier to deliver items as you need them saves the organization on supplies and space.
So just-in-time inventory management is clearly important, and so is cost transparency. As a physician, I rarely knew the cost of the medications, labs, medical supplies that I used. My decisions were made with no regard for cost because I had no cost information. Research has shown that by simply posting the cost of drug alternatives, resident physicians will choose a lower-cost drug if there's no difference to the patient care. How can cost transparency be increased in healthcare organizations?
You know, it's interesting. Few staff really understand what a procedure truly costs. This is tolerated when fees for procedures could be set with little regard to the supplies used, and the margin of the giving process was little understood. However, in today's environment, we need to know the full cost of procedures and stays and understand the differences in outcomes. This is difficult with many of the systems in place today. Yet without this information, we will not be able to contribute to the knowledge needed to make the changes required. So what's needed to increase transparency? There's really three major components. First, we need accurate data. It needs to be accurate, reliable data. The goal is to obtain the accurate data as a byproduct of the procedures that are performed within the supply chain process. This will allow for better decision making. With this data, we'll be able to make decisions based on analysis and fact rather than conjecture. However, we still need the tools that will allow this analysis to not be prohibitive. With the data and analysis, areas will be identified that are optimal for transformation based on the needs of the organization.
It sounds like the right data and technology are necessary ingredients for healthcare organizations to thrive in the value-based medicine era. How have Microsoft and Mazik used their expertise to create solutions for healthcare?
The Dynamics AX Suite is a robust, comprehensive ERP system. Mazik has added healthcare-specific elements and modules. Today we are discussing the supply chain management, but know that we also have a full EMR and healthcare-specific functionality. All these solutions include the Microsoft BI tools that provide vigorous, intuitive, analytical capabilities.
So now we can actually provide a quick solution demo of some of the technology we've been discussing. To do this, we're going to bring in Asif Bimla, Senior Solution Architect at Mazik Global. Asif is one of the many technical minds behind Mazik and Microsoft solutions.
Thank you, Jennifer. I'm glad to be here today.
So while we're waiting for the presentation, for the demo to get started, Asif, how are we tracking the inventory and the cost at the point of use with mobile PAR management?
Yeah, we have created different mobile applications that helps material manager track inventory at the point of use. I'm going to showcase one of that application today, which is Mazik Care Material Manager application. As soon as Material Manager logs in to this application, he lands on the dashboard where he can see top below par locations, vendor performances, emergency stat orders, and distribution performances. If he go further into the application, he has options to inquire into incoming purchase orders, transfer orders, requisitions. He can also see below par locations with the quantity on hand at each location. All the way to the right, he can see the sites and warehouse at each site, and if he clicks on the warehouse, he can see locations per warehouse with the color indicating whether the location is below or above par. If the material manager wants to manage each location, he can just click on the location and that will take him to the PAR workbench. PAR workbench is the central place where the manager can manage inventory at this particular location. He can still see the performance of warehouse based on the on-time and late delivery. And he can start a new count, he can replenish items from here, and he can also locate inventory. As an example, today I'm going to start a new count on different inventory items. On this screen, I can either scan the items using barcode scanner, or I can just type in the item number manually and update the count. I'm going to enter a couple of items here. So you can see right now the on-hand inventory for the item is 10, whereas the physical count that we did comes out to be 12. So I'm going to clear that out and I'm going to enter a new number. I'm going to use one more item and update the inventory. Once I'm done with the count, I can go ahead and post the counting journal. While the counting journal is being posted, the system will ask whether we want to auto-replenish these missing items. If you click yes, it will take you to a screen where you can provide the replenishment method. I'll select inventory transfer and the location. Once selected, I can go and click auto replenishment, and that will replenish those missing items.
Well, that's great. It's very intuitive and easy for you to navigate through. But how can a nurse order supplies at the point of use?
Yeah, that's a very good question. So we have similar application for nurses and staff. Let me go to the home screen here. So right now you're seeing Mazik Material Manager. We have similar application for nurse, which has exactly same interface. The only difference is that the dashboard will show key performance indicators related to nurse and clinical staff. From that application, nurse can go and create new requisitions for the item, can receive inventory, and can manage par level for each item. So as an example, I can show you that how nurse can create a requisition for items for a particular location. She can go to new requisition. She will see all the items available. She can select each, enter the quantity required, and select another item, enter the quantity required, click enter. And while she is creating requisitions for each of these items, you notice that there is a card being generated, which gives a very similar experience like we have in these days with online purchasing. Once all the items are selected, she can just click add to requisition, and that will take her to new supply requisition details form. Here, if she wants, she can add more items and adjust the time accordingly and just post the requisition. Once this is done, there is a possibility that she might have received some items already. So she can go to incoming POs and select each of the item, and she can go here and receive the order quantity. She can actually receive all of the quantity, or she can actually partially receive the quantities as well.
That's great. And with the pictures available, she knows exactly what it is she's receiving or ordering.
Exactly.
So how can we take all of this information and turn it into actionable intelligence through Microsoft's BI tools?
Yeah, the informational data that has been entered over a period of time is converted into analytical objects while we are entering the data. And this brings another application into the equation, which is Microsoft Power BI. I'm going to jump into that application now. Microsoft Power BI is a tool that gives a new dimension to your raw data. You can manage your analytical objects into different categories like material management, financials, and clinical management. Each of these categories can carry an individual analytical sheet that gives a new shape to your data. As an example today, I can pull up the inventory management sheet. While it is loading, so the inventory management sheet holds different graphs and information related to the locations which are maintaining these inventory. You can see the trending of average of slow par, average of high par, and the quantity by building at each location. Here you can filter each of these graphs according to the suppliers, and you can see that the graph will automatically adjust. Or you can also filter according to supplies. Now these are user-friendly screens that can be configured according to the user's need, and each user can have its own screen the way he wants to see this data.
Well, that's great. Thank you very much. Well, we've only covered the surface of what's available through the BI tools. I think you can see the robustness that's available there.
Thank you, Asif and Pat. So we're going to move into the Q&A portion momentarily, but very quickly, I'd like to provide some background on our organization, Mazik Global, and our relationship with Microsoft. Mazik's founders are ex-Microsoft employees. We started as a product engineering company in 2003. It was in this capacity that Mazik became one of Microsoft's core development partners. From our experiences in healthcare and life science and our Dynamics AX background, we created MazikCare and have enhanced our staff with multiple healthcare-specific support teams. As we said before, this is a joint program between Microsoft Services and Mazik Global. The solution implementation will include integration between Dynamics and other Microsoft platforms such as Office, SQL Server, and SharePoint, and our partnership will give you access to the best experts in Microsoft technology along with the best experts in healthcare applications. The Microsoft Services delivery approach supports your solution at every phase, from diagnostic and envisioning to go live and beyond. The SureStep methodology reduces risk and promotes efficient implementation, leading to faster business improvement and rapid ROI. So now that we've discussed the challenges inherent in the new regulatory landscape in healthcare and addressed the specific strategies and technologies innovative organizations are adopting to succeed, let's open the floor to questions. Many questions have come through during the presentation so far, but please feel free to add more. If you have a question or a point you'd like us to discuss, please enter it in the question field. One of the questions that's come up the most so far is, like this one from John in Atlanta. He asks, what is the typical timeline for implementations for solutions like these?
Thanks, Jennifer. That's a question that frequently comes up, and obviously an organization wants to be able to judge what it's going to take to put in these systems. While each organization's different, a lot of it will depend on how much cleaning up they want to do of their vendor and item masters. We have seen that using our SureStep methodology that these systems could be implemented in as little as about 6 months period from the time of contract signing until first implementation.
Next, Shreya in Houston asks, are these solutions available on mobile devices?
Absolutely. In fact, the presentation that is sifted a little earlier, all of those applications are available on mobile devices. They're available not only on the Surface, but also on other devices that you might have in your organization, like the iPad. Of course, we know that the healthcare world, like the rest of the world, is moving into mobile devices, and so it's important that our applications are available, and this comes as out-of-the-box technology for us. In addition, we make it easily for your organization to use barcode scanning as part of the solutions here, and if you're currently using barcode scanners, we're able to work with you on both the standards and the devices that you're already using in that space.
Now we have Len in Indianapolis asking, how do you leverage current technology investment here?
Well, we have a really good answer in that area, Len. We have, obviously, these applications are written on the Microsoft platform, so there's easy integration to the full Office suite. It's easy to download any report into Excel. We even have integration with PowerPoint. But more importantly, your investments in SQL Server and SharePoint can be fully taken advantage of with these applications because we have tight integration with those as part of the solution.
Carol in Carbondale is asking, how easy is it to train the end users on these technologies?
Well, one of the things that excites me about the solutions that we're offering is that they're very intuitive. And so end user training, as you could see when the nurse was ordering supplies, the picture was right there, so the nurse was easily able to identify the supply that she wanted and then to put it into a shopping cart. Everyone knows how to do online shopping these days, And so we've created a solution that makes it intuitive and easy to learn how to use these applications. Okay, well, thank you for those great questions. So in conclusion, we have provided an overview of the issues of understanding supply chain costs, price, and revenues. The supplies used within an organization may lead to higher quality care, which guarantees that we will receive the highest revenue possible for the services provided. In today's changing healthcare environment, the healthcare organization needs to understand cost, price, and revenue. The cost of supplies and medication are second only to personnel cost. With robust, intuitive information technology used in the supply chain processes, full costs may finally be understood. Services may be priced based on the understanding of those costs. With revenue moving to a bundle payment method, understanding the cost of services, an organization will know if there is any profit. Integrated, secure mobile solutions support this modern model of healthcare financial management that optimizes cost, quality, and outcomes.
Thank you, Pat, and thank you all for your attendance, your attention, and your questions. As follow-up items, this webcast has been recorded and a copy will be sent to each of you. Also, if you have more questions or would like to deepen the conversation, please reach out to us at info@mazikglobal.com. Further, register for our breakfast session at HIMSS 2015, where you could register at this link here. Also, please complete our survey for a free healthcare supply chain white paper. Thanks again, and please feel free to reach out for more information. Thank you.
Thank you for attending today's webinar, Transforming the Healthcare Supply Chain, featuring Microsoft and MazikCare. We hope you found today's session valuable. We very much value your opinion about today's event, so please take a few minutes right now to complete our survey. To do this, click the List button at the bottom of your screen to the right. All survey responders will receive a copy of the MazikCare white paper, Optimize Your Supply Chain to Deliver Better Quality, in appreciation for your time. Look for future webinars on the dynamicscafe.com. You will be receiving an email with an on-demand version of this webinar soon. Thank you and enjoy the rest of your day.